Hi, everybody. It's Dr. Rafich here. Good morning. July 25th, 8:48 a.m. Pacific time. We're going to talk about bloat in dogs. This is a super common issue, concern that we see as veterinarians, that pet owners see at home. And we'll go through with it from a very, very general standpoint. I will emphasize that in order for you to diagnose this, you need to at least speak to a veterinarian. So, vet triage is always a good start. And then, depending on the severity of your case, whenever you have to go into your vet, after vet triage, whether it's on an emergency basis or whether it's as an appointment, then they'll confirm it with an in-person physical exam and then diagnostics. So keep in mind this discussion is not enough to just diagnose the condition because we have to talk to you about your pet specifically and all the details surrounding your pet. And I don't want anybody using this video as a way of self-diagnosing at home. So I'll make that very clear from the get-go. But having said that, let's talk about the two different types of bloats. There's the one that pet owners are most familiar with. It's the scary one that if you Google something, it'll come up everywhere. It's the one I didn't see this movie, I guess, but I heard in Marley and Me or something, the dog movie. The dog died of bloat, I guess, or they put it to sleep because of bloat. But anyway, the gastric dilatation and volvulus, which is GDV, that's the scary bloat where the stomach twists on itself and that causes a life-threatening surgical emergency. I do have actually plenty of in-depth talks on my channel about GDV or bloat in dogs. Feel free to review it. They're about maybe 45 minutes to an hour long videos, but they're all the details that you need. They are made for veterinarians, but pet owners I'm sure can watch them and understand good enough that and get information out of it. But that form of GDV, where the stomach twists on itself, gastric dilatation and volvulus, is the one that everybody's worried about, they're scared of. It's life-threatening, requires emergency surgery, and is the one you typically will see in large breed dogs that are deep-chested, middle-aged to older. They have constant non-productive retching, vomiting, drooling, progressive abdominal distension, and they get sick very, very quickly, like within hours, if not minutes. They need surgery immediately for the majority of them, and the faster you can get them to the emergency hospital and surgery, the better off you are. And that's GDV. Now, the one that's probably even more common, maybe even underdiagnosed, is just your standard gastric bloat. So we use bloat as a layman's term to mean GDV, but really when you say bloat, literally what you're saying is the stomach is distending without the volvulus part. So gastric dilatation and volvulus means gastric dilatation, so distension, with volvulus, so it twists. And that twisting is what makes it an emergency. With regular bloat, which is just gastric distension, that is not the same thing as GDV. You need to have the volvulus, the torsion, in order to call it a GDV, and also to make it an emergency, whereas your standard gastric bloat is not an emergency. So what's the difference? Well, any dog can be affected with either condition. However, the GDV, as I mentioned, is usually your large breed to extra large breed dogs, whereas gastric bloat can happen in any breed, any size of dog. The GDV usually happens in middle-aged to older dogs, like I said, whereas gastric bloat can happen in any age dog. And then the symptoms of constant vomiting, non-productive retching, drooling, progressive abdominal distension, and the animal getting sick within hours or minutes is pretty classic for GDV, whereas regular bloat, it's not the case. It can go on for hours or days, and there'll be no vomiting, no diarrhea, no drooling. The belly gets kind of distended and kind of not, and they have flatulence, they're restless, but it's sort of this waxing and waning gastrointestinal condition that's not as para-acute or acute as GDV is. The only way to confirm it, of course, is by talking to a veterinarian and then finally getting diagnostics done, because the stomach looks a specific way on radiographs or x-rays, which is the first diagnostic tool your veterinarian is going to use to rule this condition out. They look very different from each other, and so they're pretty distinct. But a lot of times, if you don't have access to X-rays, you live in the middle of nowhere, you're speaking to a triage veterinarian where we don't have access to diagnostics, we can investigate the history and look at your pet and make a pretty reasonable guess, as long as the pet owner, of course, understands that we can't prove what we're saying is true or not true, but we can make an educated guess on whether your dog may have bloat versus GDV. If your dog does have bloat, we're not going to go into specific treatment options here, because again, that should be tailored to your specific dog and should be directed to you by the veterinarian in charge of your case. But in general, for bloat cases, we're going to try and reset their stomach. So like, don't feed them, don't give them water for a certain amount of time, and then eventually reintroduce water, reintroduce food, maybe do bland food. Antacids might be a good idea for them to help with the esophageal reflux, the heartburn, as well as the gastritis that's happening because of the stomach distending. And then frequent walking. If you can walk your dog often, it helps with gastrointestinal motility. And then there's maybe some other things you can consider depending on your case and your discussion with the veterinarian. Probiotics might be a good option. Tums might be a good option. There's electrolytes might be a good idea. It all depends on what your veterinarian on vet triage or in person thinks, and it depends on the specifics of your case. So you want to tailor those palliative care advice to the case itself. Oh, we have an audience member. Feel free to say hi or any questions you have. Thanks for joining. So that's the difference between GDV and bloat. That's how we think of them. You might be asking, well, what causes either condition? And the easy answer is we don't know. For GDV, there's a whole host of potential causes. I list a lot of them in the lecture, and I don't even mention, or lectures on my channel, and I don't even mention all of them because there's so many, not necessarily causes, but associations, relationships with the history of dogs and what can cause a GDV. But there's a myriad of causes. For your standard gastric bloat, it usually is either some other condition that's causing nausea, or they got into the cat food or the cat litter, or they got into their dog food and they're eating a bunch of stuff and they eat it really fast and their stomach gets distended. I compare it with pet owners like Thanksgiving dinner. You go, you overeat, you indulge, and then you feel gross afterwards. It's kind of what bloat is for dogs. It's like that, as opposed to the GDV with torsion. That may not necessarily be the case. There's many factors that can relate to it. And again, talking to the veterinarian specifically about your case can determine what maybe had caused it. But a lot of times with GDV in dogs, despite knowing all this stuff and running all the tests, you don't end up finding out what's going on with it. So there's a third category that I'll mention briefly that I do believe exists, and I call them chronic bloaters. And these are dogs that do have GDV, but they have it intermittently. They'll do a GDV and then it'll resolve on its own at home. And then like days, weeks, months later, it'll happen again and it resolves again on its own. I've had dogs that walk in with GDV that don't show any of the symptoms that a normal GDV would show. They're not that sick. They have abdominal distension. They're maybe drooling a little bit or not. And they've been doing it for hours or even days. And normally a dog with GDV that's waiting hours or days is going to die. And so these dogs are not in that condition. And if you investigate the history more with the pet owner, you realize this dog has had bouts of this in the past. So it's not as big of an emergency, but the reason why I bring it up is because it's a bit trickier. It doesn't help you differentiate, at least based on telehealth, whether or not what you're dealing with is a GDV or a bloat, because the symptoms are kind of a mixed bag of in between. But that's a tricky one. I also think it's also not very common at all. And I only notice it as a specialist myself, having seen many GDVs in my career. Sometimes these dogs have more of a chronic history. So important investigation by the veterinarian is required in order to figure that out. But we'll see. Maybe in the future there'll be a research paper on it. Who knows? All right, I think that's a pretty good place to stop. Thanks to everybody who watched on the playback. We had 2 audience members today. Thanks for joining. Thanks to everybody who's donating and subscribing and following and hitting like. Feel free to spread the word. And I look forward to being here again tomorrow, Friday, July 26th, We'll do another live stream and talk to you guys then. Take care. Bye. 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 Bye.